name is Maureen Dunn, and today I would like to take a few minutes of your time to teach you about a creation from 1958 that has saved many lives and is still used to this day. February is American Heart Month. Pacemakers are just one of many things to help the heart. This small but powerful device has saved and given so many people the peace of mind to be able to enjoy a longer, more productive life. Did you know that your heart is the size of an adult fist and beats 115,000 times a day, pumps approximately 2,000 gallons of blood throughout your body daily, weighs less than 1 pound, and that a woman's heart beats slightly faster than that of a man? Did you know that the heart has a natural pacemaker that is called the SA node? It sends out regular impulses from the top chamber of your heart, causing it to contract and pump blood into the bottom chamber, which is also known as the ventricle. The SA node sets the rate and rhythm of your heartbeat. When your heart's natural pacemaker is defective, your heartbeat may be too fast, too slow, or irregular. You would then need an artificial pacemaker, cardiac pacemaker. So I'm just going to show you guys, this is what, and I'll pass it around, this is what your regular heartbeat, you can see, is supposed to be, and then an irregular heartbeat. And this would cause you to have, to possibly need a cardiac pacemaker. This is what they call atrial fib. A pacemaker controls your body's electrical system, which regulates your heart rhythm. It uses electrical pulses to trigger the heart to beat at a normal rate. If your heart is pumping too quickly or slowly, your body is not getting enough blood. An implanted cardiac pacemaker mimics the action of your natural electrical system. I've worked in cardiology for the past 7 years, and I've seen firsthand how the cardiac pacemaker has saved lives and given people the ability to resume their normal activities, exercise, and just enjoy, their life and their family. As I mentioned in the beginning, the pacemaker came about in 1958. The cardiac pacemaker was invented by William Greatbach and first used in 1960. It has improved throughout the years and has extended and saved countless lives along the way. The first pacemaker was implanted in a person in 1958. The patient was 88 years old and had 26 pacemakers in their lifetime. And now I'm going to share some facts with you about the pacemaker. So this is your heart. And I'm going to show you, your heart is a muscular fist-sized pump with 4 chambers, 2 on the left side and 2 on the right. The upper chambers, the right and left atria, and the lower chambers, right and left ventricles, work with your heart's electrical system to keep your heart beating at a proper rate. Your heart's electrical system controls the heartbeat. It begins at the top of your heart and spreads to the bottom, which causes it to contract and pump blood. Depending on your body's need for oxygen-rich blood will determine how fast your heart will beat. At rest, your heart should beat about 50 to 100 times each minute. When you are excited or doing activity, your body needs more oxygen-rich blood, and your heart rate can rise well over 100 beats per minute. Aging heart muscle damage from a heart attack, surgery, some medications, and certain genetic defects can cause an abnormal heart rhythm, which would require you needing a pacemaker. Okay, so the pacemaker. As shown in this picture, an implanted electronic pacemaker mimics the action of your natural electrical system. A pacemaker is comprised of two parts, a pulse generator, and I have some different types of pacemakers to show you. This is just like that in the picture, this pacemaker. Although I don't have the electrodes that actually connect to the heart. A pacemaker is comprised of two parts. The pulse generator, this is the small metal container that houses the battery, and the electrical circuitry that regulates the rate of electrical impulses sent to your heart. The leads, and here's some different ones too. This is a dual chamber pacemaker. So it goes into both sides. It goes into both sides of your heart. The leads, also known as the electrodes, there can be 1 to 3 leads. They are flexible, insulated wires that are placed in a chamber or chambers of your heart and deliver the electrical pulses to adjust your heart rate. Pacemakers only work when needed. So where does the cardiac pacemaker go? It goes right up above, right about here by your shoulder. And the surgeon just makes, it's just a small incision, and he will then guide a small wire through the incision into a major vein near your collarbone. The surgeon will lead the wire through your vein to your heart. An X-ray machine will be used to help the surgeon in guiding the wire. Here is now what they have come out with. This is the latest. Not everybody is a candidate for this. This is the latest model of the pacemaker. It's called the Micra. This little thing is guided through the groin up to the heart, and these things deploy. You'll see there's 4 things. They deploy into the heart, and you don't need the leads anymore. So you don't need the wires.
You don't need those wires.
No.
Deploy.
Deploy. Sorry. Using the wire, I'm back on the old-fashioned one now. Right. Using the wire, the surgeon will attach the electrode to the heart's right ventricle of the heart. The other end of the wire attaches to the pulse generator. If you need a biventricle pacemaker, the surgeon will attach a second lead to your heart's right atrium and a third to the left ventricle. The generator is typically implanted under the skin near the collarbone, under the collarbone. The incision is then closed with stitches, and you will be in the hospital overnight for observation. If you ever have to go in to have certain types of surgeries and then like some MRIs and stuff, they have to turn the pacemaker off so that it doesn't pick up certain things. This is a very high-powered magnet, and they just place this over the pacemaker and it turns it off. So you can see how it's really... Who would qualify for a cardiac pacemaker? One may need a pacemaker if your heart is pumping too quickly or too slowly. Your body doesn't get enough blood. It can cause fatigue, fainting, or lightheadedness, shortness of breath, damage to vital organs, or even death. Pacemakers regulate the body's electrical system, which controls the heart rhythm. Pacemakers can also track and record your heartbeat, which can help your doctor better understand your arrhythmia. Not all pacemakers are permanent. One may need a temporary pacemaker after a heart attack or heart surgery. One's pacemaker will be checked every 3 to 6 months. The pacemaker's battery should last 5 to 15 years before it will need to be replaced. In conclusion, pacemakers are meant to keep your heart from going too slowly by restoring your heart to a normal rhythm. They help your heart pump more blood to your body. Getting a pacemaker will allow one to resume their daily activities. By regulating the heart rhythms, one will have more energy to do the things they enjoy. Thank you.
Wow, thank you. That was informative.
Question? We have a question.
Yes.
Never mind, I don't have a question. I was just putting my hand up, I'm sorry.
That was, you were great, also.